So one of our exercises that we use very often in many aspects is called the hip 90-90 position. Meaning, when you look at the hip in front of you, you've got one that sits in a externally rotated position. The other one is even 90 degrees to it, and the back leg is at 90 degrees to it. So it creates that angle there, angle here, and angle there. From here, we can play around with a lot of different positions, but for right now, most of it's going to be for the thoracic rotation. But we're going to get there by slowly understanding how to lean forward and slowly get to where we're facing over here. This one's going to get to a point where you can touch in front of you and then come back up. And then more rotation, more. The whole time, knees and feet are staying down to a point where you're going to get your elbows all the way to the side. And anytime we're doing these exercises, if you're in a position that you cannot breathe in, we back off and we get to a position that you can. So if you can't get down to here, then take a breath. We're not there yet. So we'll go up a little higher and make sure we can breathe here. And if we get lower, we'll get lower. From there, one last little add-on is you don't have to walk in front of you like this every time. You're going to get to a point where you can just reach behind and go down and then come back up, which is a mobility drill on its own. We like it because it works, again, external rotation of this hip and internal rotation of this hip. We use this position for a lot of things, like I said, but this is our go-to for one of the thoracic rotation drills. Thanks for watching.